So we're really lucky finally to have a decent portfolio of fillers in the United States. For many years I was so jealous of my European colleagues because they had a tremendous range of fillers to work with. And now, not all of them, but a good number of them are here in the United States. Now you might say, well, why does it really matter? But they're not all the same. And here we're talking about the hyaluronic fillers. And by that I mean fillers that are based upon hyaluronic acid, a very simple sugar present in almost all the tissues of the body, so very well tolerated, and also very easy to remove. If for some reason you don't like it, you can inject something else called hyaluronidase and melt it away. So these are our favorite fillers in the practice. So one way to look at it is essentially thick fillers, medium fillers, and real thin fillers. So what's great about the thick fillers, which are relatively recent in the United States market, is that you can use them to provide a robust, deeper structure. So for example, if you want to restore volume to a cheek or other key areas, you can put this in. It tends to really do a good lifting quality, and it tends to last a good amount of time. So that's at one end of the spectrum. And then you have the very thin fillers, which often don't last quite as long, but can be very, very useful for filling in a delicate way, very fine lines in the face. And then there's what you might consider the in-between fillers. Those are the ones that have been around a long time, and they're still very useful. We put those most commonly in the plane right underneath the skin. Often nowadays we're going to combine them in one patient, and we'll also do things, for example, if I'm trying to treat a tear trough here, I may, in conjunction with a deeper filler to the cheek, I may take one of those intermediate fillers and actually blend it down a little bit so that there isn't a good trace of it, and then use that to soften this area. And I've found that that works extremely well. Obviously in plastic surgery we have a particular advantage because we truly understand the anatomy, the three-dimensional structure and so forth. We also know where the blood vessels are and how to avoid them. So the fillers are great by themselves, but very often we combine them. One of the most common combinations, of course, is with Botox, because then you can address some of the expressive qualities of the face, plus you can just address volume. Sometimes we'll combine them with surgical procedures. There's really no limit. And then, of course, let's not forget the most versatile and, in my opinion, the best filler of all, which is a person's own fat, because then you're really replacing like kind with like.